Thank you everyone for joining us today on our October feedback event for Waiver Reimagine. We are really happy you're able to join us today. Next slide, please, Dan. So this event is focused on the future of self-directed services and ideas to improve and expand self-direction. As I said, we're grateful that you're here and that we really appreciate you sharing your input with us today. Next slide, please. Today we'll be discussing the current self-direction model, which is consumer-directed community supports, or CDCS, as well as the future of self-directed services. And we'll be sharing some ideas for improving and expanding access to self-directed services. As part of this event, we want to know your ideas for the future of self-direction and what that might look like, as well as your feedback on the ideas that are presented today, as well as to gather other ideas that you have. Next slide, please. A few introductions before we get into the rest of this event. My name is Carissa Propson. I am a senior consultant at the Improve Group. The Improve Group is a research and evaluation firm that's conducting today's event. And I am here with several of my colleagues who you will have in your, many of whom will be in your small groups as facilitators, as well as our technology support for today, Dan Goldstein, you'll see in the chat, and moving us through the technology pieces. Next slide, please. I also want to introduce the members of the Minnesota Department of Human Services Disability Services Division who are here with us today. Elliot Rankin will be presenting, and there are several other members of that team who are here to answer questions and participate in the event. A couple of notes on using Zoom. You are free to turn on and off your video throughout this event by clicking the image of a camera in the bottom left of your screen. For audio, we will be muting all microphones in the large group just to prevent feedback or other issues. You will be able to turn your microphones on in the small group if that is desired by clicking the image of the microphone, or if you are calling in by phone, you can mute and unmute by pressing *6. You can also rename yourself to show your name or affiliation and pronouns if you would like by clicking the image of two people. That opens the participant's name and you can rename yourself there. And finally, we do have the chat feature available for communicating with the Improve Group and DHS staff at this event. You can chat questions on today's topic to either of our hosts, Dan or Russell. And you can also chat Dan Goldstein directly for tech help, or use the raise hand button in the participants pane, which is *9 on the phone if you're calling in. I also want to note that today's meeting will be recorded in the large group, and we will be sharing the recording after the event. So a brief overview of our time together today. We'll begin with some presentations about Waiver Reimagine and how it's related to the future of self-direction, as well as some feedback from stakeholders about self-directed services. Then we'll move into a small group discussion to discuss your experiences and ideas around self-direction. Then we'll come back to the large group for another presentation on ideas for expanding and improving self-direction, and then move back into the small groups for your reactions and additional ideas. At the end of today's event, we'll have some time for questions and answers from the DHS team, and then we'll wrap up talking about how to stay engaged with this process. The feedback that you share today will be influencing plans for the future around improving and expanding access to self-directed services. And I want to assure you that these changes are in early stages and that there will be many more opportunities to provide input and stay engaged over the next several years. I also want to note that we can answer some questions today about the information that is being presented. That will happen during that Q&A section. But we will record all questions, and DHS will have them to address in the future. At any time, you can feel free to chat in your questions about today's topic. I also want to note a couple of guidelines for this event. We ask that you stay on topic when you're asking questions or giving feedback, and we might use some strategies to record and gather ideas that are not on this topic. And we also ask that you're respectful toward all participants and hosts today. Before we move on, I'd like to clarify some terms that I've started to use and that we'll be continuing to use throughout this event. The first is traditional services, which is a term that's being used to describe services that are traditionally delivered and managed by a DHS enrolled or licensed agency. So examples of some traditional services are licensed adult day services, licensed positive support service, and customized living services. I'll also be using the term self-direction, which is a general term to describe when a person who accesses service employs their own service providers and has control over how their services are delivered, who delivers them, and how their budget is used. This can look a lot of different ways through many different programs, but today we're going to be talking about people who self-direct home and community-based waiver services. And that brings us to consumer-directed community supports, or CDCS, which is the current option for self-directing waiver services in Minnesota. So we'll be using these terms throughout this event. More on the topics for discussion at this event. We'll have many topics, and we'll be thinking about consumer-directed community supports, as well as the expanded self-direction options under Waiver Reimagine. We'll talk a bit about services that can and cannot be self-directed, as well as your ideas for making self-direction easier and more available to people. There are also many topics that are important but will not be addressed today, and those include coverage of specific items or services, the Min Choices Assessment, some workforce and staffing shortages, COVID-19, and the housing and economic crises. So with that, I appreciate your time, and I'd like to turn it over to Elliot to give us a brief overview of Waiver Reimagine.
Hello, everyone. My name is Elliot Rankin. I work for DHS in the Disability Service Division. And first, I just want to give a brief overview of the Waiver Reimagine project to give some context and explain why we're talking about self-directed services, starting with just a short video from the director of the Disability Service Division.
Minnesota Department of Human Services, Disability Services Division.
Hi, I'm Natasha Mers, Director of the Disability Services Division at the Minnesota Department of Human Services. My division works with you and partners like tribes, counties, providers, and advocates across the state to ensure that you have opportunities to live the life you want in the community. Thanks for joining us. I'm excited to tell you about Waiver Reimagine. It's a project that will simplify the waiver system and give more options to you and your family. But first, let's start with some background about the waiver system. Waivers are a way to pay for home and community-based services that support you to live in the community rather than an institution. Waiver services can help you take part in community activities and support you at work. For decades, you, your family members, and many advocates have worked with the state to create a system of supports and services that focuses on home and community-based services. Your advocacy has played a vital role in making the system more person-centered and continues to inform the improvements we're making today. As the need for waiver programs grows, the service system must respond and adapt to challenges that we've heard from you, your family members, and advocates. This will ensure you can lead meaningful lives based on your own goals and what is important to you. So what is Waiver Reimagine? We've heard from you that the waiver system is too difficult to understand. You told us that you aren't getting the information you need and that the system limits your flexibility, control, and choice over services. Waiver Reimagine is designed to shift the power balance. It will make the system simpler and give you more control so that you can focus on what is important to you and important for you. Waiver Reimagine began because we heard from you, your family members, and advocates that these improvements are important. Your input will keep shaping our work like it has from the very beginning. Now, let's talk about some of the changes and what they will mean. We're starting with simplifying the waiver services menu to make services easier to understand. The system will be simpler, and you will still get the supports you need. Over the next several years, we will work with you, your family members, advocates, providers, tribes, and counties to make more improvements to the waiver programs. They will be easier to understand and give you more options, control, and flexibility to choose your services and supports. We want you to stay engaged in Waiver Reimagine. Like I mentioned, we started this work hearing from you about how you experience the waiver system. Your input has shaped Waiver Reimagine's goals and the project's course. As we move forward, your feedback is really important to us, as it always has been. We're hosting a series of online events to get feedback directly from you about different aspects of Waiver Reimagine. You can find more information and learn how to engage at the Waiver Reimagine website. We'll regularly update the page with your feedback and how we're using it. Disability Hub MN is also a great resource for you and your family. Links to both of these pages are included in the video description. Thanks for joining us. We've heard from so many of you that you're excited to share your thoughts about Waiver Reimagine. Please get involved and invite your friends and family to provide feedback too.
Waiver Reimagine, an introduction from the Minnesota Department of Human Services Disability Services Division.
Okay, so that was just a quick overview of what the Waiver Reimagine project is and kind of what DHS's vision is for the future. So Waiver Reimagine, it does not affect a person's eligibility for a waiver, and these changes are happening in phases over several years. So the ideas that we'll be talking about today will happen in the later phases of the Waiver Reimagine project. Next slide. One of the most significant and last things that will change is that the 4 waivers that exist today will be consolidated into 2 waivers. This is intended to create unity between the 2 waivers, increase equity, and make them easier to understand and navigate. Both the individual and residential support waivers will encompass the 4 levels of care and other eligibility criteria associated with the 4 current waivers. As a result, eligibility requirements remain essentially unchanged for the people who use services. Next slide. And depending on where a person lives, they'll access the corresponding waiver. So people who live in a provider-controlled setting like a family foster care, a community residential setting, or customized living will access the residential supports waiver, while people who live on their own or with family will access the individual supports waiver. So this is a broad depiction of the way that setting determines the services for the services and the waiver. There are other services available between the 2 waivers, like employment and day supports, intervention services, and environmental accessibility adaptations. Today we'll be talking about how anyone can choose to self-direct services, regardless of which waiver they use, and therefore regardless of where they live. Next slide. Here's an overview of the Waiver Reimagine timeline. In 2018, we conducted extensive research and stakeholder engagement that informed the Waiver Reimagine legislative report and recommendations. In 2019, the changes that simplified the service menu were passed into law. And this year, in 2020, we're continuing to research reshaping the waivers, individual budgets, and self-direction. We're conducting more stakeholder engagements like this one to inform policy and a second legislative report. Going forward into the future in 2021, the simplified service menu will take effect January 1st, 2021. We'll publish the second Waiver Reimagine legislative report with more detail on reshaping waivers, individual budgets, and self-direction. In 2022 and further beyond, after approval from the legislature, we'll submit plans to the Centers for Medicare and Medicaid Services, or CMS, and the implementation will be in 2023 or later. So both Waiver Reimagine and our legislative directive are leading us to expand self-direction options. The next slide. So when we're talking about self-directed services, we're really talking about when a person is the employer, and they are choosing how to use their budget. So right now, Consumer-Directed Community Supports, or CDCS, is the self-direction option on all 4 of Minnesota's disability waivers for waiver services. People are given a set budget based on their Min Choices assessment and can choose the services and supports that are important to them and important for them. CDCS is a flexible option for people to adjust their self-direction level. They can hire their own staff or purchase traditional services to get support. There are 4 categories in CDCS under which supports can currently be purchased, and those are personal assistance, treatment and training, environmental modifications and provisions, and self-direction support activities. And everything falls into one of those categories. Next slide. There are some limitations in CDCS depending on where a person lives though. So currently, people who use residential services like family foster care, corporate foster care, and customized living cannot self-direct any of their services. So CDCS is not an option for them to use. As Waiver Reimagine moves us from 4 waivers based on a person's diagnosis to 2 waivers based on where a person lives, we're revisiting the limitations on self-direction. We are considering which types of services can be self-directed in different living settings and how these changes should work. When the 4 waivers are consolidated into 2 waivers, many people use the residential support waiver. Some changes will need to be made in order to make self-direction available to everyone. We have some ideas on what these changes could look like, but we need your thoughts and input to make sure that we're moving in the right direction. Another reason we're talking about self-directed waiver services is that DHS has been given direction from the legislature to have a self-direction first policy. This also includes the requirement that everyone on a disability waiver has the option to self-direct their services. This aligns with what this group collectively told us from the pre-event input form. Almost 90% of all stakeholders believe that everyone who accesses disability waivers should have the option to self-direct their services. Next slide. And so there's also some information about CDCS, the current self-direction program that we wanted to share. So in 2019, 48,738 people accessed a disability waiver, one of the 4 disability waivers. Of that number, 7,133 of them are used CDCS, which is only about 15% of the total waiver population. So that means that 41,685 or 85% did not use CDCS. Next slide. And then children are about half of all CDCS users. So of the 7,133 people who used CDCS in 2019, half of them were, or 53% were children and 47% were adults. So this data makes it look like CDCS usage among children versus adults is relatively equal, which is true when we're just looking at CDCS. However, with the next slide, the information looks a little bit different when you compare these numbers to the total number of people who use a disability waiver. Next slide. This is because there are significantly more adults who access a disability waiver than children. In 2019, 5,401 children accessed a disability waiver, while 43,403 adults accessed a disability waiver. So when we compare the usage of CDCS between adults and children among all waiver recipients, there's a large gap. So children who are on a disability waiver are nearly 9 times more likely to use CDCS than adults who are on a disability waiver. There are a lot of factors that people consider when choosing to self-direct through CDCS, and DHS is evaluating these factors to ensure that people have access to CDCS and that policies don't create inequity. So we've also received some feedback from stakeholders about self-directed services in the past. In 2018 to now, we've heard some of the following information from people who use services, case managers, and advocates, among many other people. Next slide. In 2018, DHS held stakeholder focus groups with an external partner, HSRI. These groups were conducted with waiver recipients, family caregivers, service providers, advocates, contracted case managers, and lead agency personnel. What DHS heard was that overall CDCS is a positive program that empowers people with choice and control. People can hire staff that meet qualifications and cultural competencies they desire. They can pay staff above average wages, pay family members, including parents, and purchase unique items and services. Next slide. Additionally, we heard some things that are challenges that need to be addressed. Some of these challenges are the budget allocation may limit the range of supports that people can use. There can be delays in obtaining CDCS budgets from DHS. Some people experience challenges with plan review and approval, and it can be difficult to understand what services and goods can and cannot be approved. While not all of these are within the scope of today's discussions, there will be opportunities in the future to provide additional feedback and ideas. Additionally, the responses from the pre-event input form from this group showed that only about 1/3 of respondents indicated that they're very confident in their understanding of CDCS. Next slide. So most respondents believe that everyone should have the option to self-direct their services. However, people were unsure if all people currently have that option. So this is something that we learned from the pre-event input form, as well as that CDCS can be difficult to understand. So among people who access CDCS and their family members, most respondents shared that they develop support plans with help from others. Lead agency staff, service providers, and advocates have challenges understanding what is covered through CDCS, understanding the CDCS budget process, and evaluating the support plan. Stakeholders commonly use CDCS policy manual or professionals like case managers or colleagues to get more information about the program. Next slide. And just as a reminder, the ideas and changes that we're talking about today are not happening right now. Nothing will be changing in 2021 or 2022. We're still developing and researching the updates to self-directed services for 2023 and beyond. Additionally, any changes require input, research, development, and also legislative and federal approval. We're only just beginning to explore how self-direction will look in the future, and there will be many opportunities to provide input and stay engaged. Now I will hand it back over to Carissa.
Thanks, Elliot. So with that brings us to the small group discussion time, and I'll explain a little bit about what that process will be like. Next slide, please. So each of you will be moved into a breakout room in Zoom with other participants. There will also be a facilitator from the improved group in that room with you who will give instructions and ask the group questions. Our small group discussions today will last about 20 minutes, and the facilitator will keep track of that time and let you know how much is left. And then at the end of that time, you'll be automatically moved back to the large group to continue the event. Next slide, please. As I said, your facilitator will be asking you some questions about what you think self-directed services could look like in the future. And they're gonna ask a question about imagining that there's a completely new self-direction program that's easy to use and available to everyone who accesses disability waivers. They'll ask you about what that will look like, and then as well as some additional questions related to your experiences and perspectives. Next slide, please. And reminder of the guidelines for this event, we ask that you'll stay on topic when asking questions or giving feedback. Your facilitator might use a parking lot to record your ideas or questions that come up. We also ask that you're respectful of participants and hosts during your small group, and that includes listening, assuming good intentions, and offering ideas and solutions. And then for the small groups, we'll also note that we are expecting that one person will share at a time, and that there will be a time for each person to share. And I also want to remind you that there are no right or wrong answers. We're really interested in what your thoughts and ideas are on what self-directed services could look like. So with that, we will have Dan move us into the breakout rooms. All right, welcome back, everyone. Looks like we are all back here in the large group, and I will turn it back over to Elliot for the next section of our presentation. And I also want to encourage you, as if questions are coming up for you during this presentation or as a result of your small groups, please feel free to add those to the chat and they can be addressed later during the question and answer section. So if you have questions, please put them in the chat, and otherwise, Elliot, I will turn it to you.
Okay, thank you. Welcome back, everyone. So next, I want to share with you some ideas that about how self-directed services could be expanded and improved. If you want to go to the next slide. We'll be asking you about your thoughts and ideas on some of the, in the next small group discussion. So first is to have self-direction options available to all people on a waiver. About 2/3 of the people who responded to the pre-event input believe that everyone who is on a disability waiver currently has the option to self-direct their services. However, people who live in a group or shared living arrangement like foster care or customized living cannot currently access CDCS. People have also shared that even though residential services cannot be self-directed, there are some other services that people could self-direct. About 90% of all stakeholders who completed the pre-event input believe that everyone who accesses disability waivers should have the option to self-direct services. Self-directed service options for everyone would mean having options on both the residential support waiver and the individual support waiver. And we're exploring which services and supports could be self-directed for people who live in a shared living arrangement, as well as how the self-direction will compare to the options for people who live independently or with family. Next slide. Of that 90% of people who believe that everyone should have the option to self-direct their services, 95% of people who access services and their family members believe everyone who accesses a disability waiver should have the option to self-direct, and 85% of advocates, lead agency staff, service providers, and members of the general public hold that same opinion. Next slide. The second proposal is regarding budget equity. Currently, people who choose the CDCS option have an individual budget determined by a formula based on their min-choices assessment, while people who only use traditional services access supports as a lead agency-wide budget. We propose budget equity across both traditional and self-directed service types. This means that people who self-direct services would have equitable budgets to those who choose not to self-direct. And budgets will be discussed in further detail during another event that will be happening in November, if you're interested in hearing more about that. And third, our proposal is what we're calling an a la carte option. Right now, when a person manages their CDCS budget, all services come out of one pot of money that is authorized by the lead agency and then managed by the financial management services provider. Even if the person chooses to use traditional waiver services like day training and habilitation, the FMS provider pays the DT&H provider for that service, instead of the DT&H provider billing for the service directly through the state system. So currently, people who choose CDCS generally self-direct all of their services, and some people find it hard to manage and pay for a mixture of self-directed and traditional services. In the future, we want to increase options for people to mix and match the services that best fit their needs. And again, we're calling this an a la carte option. And that would pull waiver services away from the CDCS budget so that the services would be authorized as usual and not through an FMS provider. This would help the person have a clearer understanding of the budget that they have available for their self-directed services, assist the case manager in coordinating the person's services and budget, as well as remove the responsibility of the FMS provider to be an intermediary. This would also give people more flexibility and clarity in how their budgets can be used. Currently, this does happen with state plan services like PCA and home care, And so this is really kind of along that same thought. Next slide. Based on the pre-event input, these are some of the top choices for self-directed services that could be offered on the residential support waiver. According to people who access services and their family members, people who live in a group or shared living arrangements should be able to self-direct getting supplies and equipment, independent living supports and training, and positive supports. And according to lead agency staff, service providers, advocates, and members of the public, people who live in a group or shared living arrangement should be able to self-direct their day services, transportation, and positive supports. There are many other services that people chose as well, but these are representative of the top selections from that input form. Next slide. And here is a list of the types of services or supports that we have come up with that could be self-directed on both the residential support waiver and the individual support waiver. Again, this list, along with all the proposals or ideas, are not final, but so we need to hear from you what you think about these ideas, and then we can take that information to the legislature for further approval and any changes that we need to make. Next slide. This is a list of supports and services that could be available on the individual support waiver. These are services that would not be available for self-direction on the residential support waiver because they're already included in a residential service. So many of these are something that a person who's receiving a residential service would already receive as part of that foster care or customized living service. Next slide. And here's a list of proposed services that would not be available to be self-directed on either of the two waivers. These supports are typically either unplanned or have specific limitations already in place that would not allow for self-direction. And let's see, so be going back to your small groups. I'll hand it back to Clarissa.
Thank you, Elliot. So now we'll be moving back into the small groups to discuss these proposals that Elliot just shared. The process will be similar to last time. You'll be moving back into the same small groups. Next slide, please, Dan. The small group discussion questions for this section will be: what do you like about the proposed changes? What concerns you about the proposed changes, and how could those concerns be addressed? Your facilitator will also ask what's missing from or not addressed in the proposed changes, and also ask what other ideas that you have. So Dan, could you send us back to the small groups for 25 minutes, please? All right, welcome back, everyone. I hope you had a productive conversation in your small groups. We have a couple of minutes here set aside to answer some questions that have come in about self-directed services. I'm going to turn it over to Elliot to answer those questions.
Okay, so we received a couple of questions. One is, what range of supports are currently included with CDCS? So we're actually going to put a link in the chat to some additional information about CDCS on the webpage. And this page provides quite a bit of information about what the CDCS program is. And there's also a link to the CDCS Consumer Handbook, pages 7 through 9, which provides more information about the services and supports available under the CDCS service categories. Another question we received is, why is caregiver living expenses not listed for self-directed services? Is it way underutilized? Same for crisis respite. So the list that we showed is not a final or full list. We will add caregiver living expenses to our team discussion about self-directed services. And you can, please submit additional feedback to the Waiver Reimagine email. Similar question about why transitional services cannot be a self-directed support. And again, the list is not final, but we will add that list to our team discussion as well. So you can continue to submit any feedback to the Waiver Reimagine email. Another question we received is, what is meant by transitional services? Transitional services is a waiver service that items and expenses necessary and reasonable for a person to transition from an eligible setting to their own home. On slide 41, you have ILS. However, isn't that being replaced with IHS? So independent living skills being streamlined into individualized home supports. Yes, ILS is being streamlined into individualized home support services, or IHS. So thank you for pointing that out. Also on page 41 is so awesome. It makes me want to cry in the best way. Thank you. We are also really excited for the expansion. So we appreciate that feedback. Another question, budget equity seems great, but would it mean money just reallocated from traditional users? The new budget methodology is being developed based on current services, assessments, and service utilization for both traditional service users and CDCS users. There is not a reallocation of funds from one user group to another. Next question, would budget equity do away with the increased budgets allowed in CDCS for some things like employment services? We anticipate that the current CDCS exceptions would not apply to the new budget methodology, but we are developing exception processes for all people as part of the budget work of Waiver Reimagine. Would the same provider be able to provide multiple options to them, or would they have to provide a different provider for each option? For example, provider provides ILS and assisted living. DHS is simplifying the service menu, and ILS will be streamlined with other like services into a service called individualized home supports with training. A person may only receive customized living, the waiver service name for assisted living, and the individualized home supports with training when a separate provider delivers individualized home supports with training. The provider cannot have any direct or indirect financial interest in the property or housing in which customized living services are delivered. I believe there were also some additional questions that we received that we, like I said, we're just beginning this process, so we may not have all of the answers for everything, but there are going to be additional opportunities for feedback and questions in the future, and we definitely welcome you to continue to participate and provide input, because this is something that will take some time, and we want to hear from everybody what you think.
Great. Thank you, Elliot. So we have reached the end of our, almost to the end of our time together. And I want to talk a little bit more about how you can stay engaged. Next slide, please. As part of this series, we've been hosting online events since August to gather input on the changes related to Waiver Reimagine. So in August, we talked about the simplified service menu. September, we talked about reshaping the 4 current waivers into 2. This month's event is on self-directed services. And then in November, the topic will be on individual budgeting. If you'd like to participate in that, you can register for the event, or you can participate in the pre-event feedback or input form like you may have seen for this event. We appreciate your participation in these events, and the goals are really to ensure that people have accurate information, as well as to solicit feedback, which we heard some great feedback from you all today, and seek buy-in as we move forward. And these events and the changes related to Waiver Reimagine will continue to be communicated in several ways, including the video that you saw, social media, on the website, and other marketing materials. Next slide, please. You can learn more about Waiver Reimagine and about these events by visiting the Waiver Reimagine webpage. The link is on the screen there and should be in your materials that were sent to you. If you have other questions or you want to provide further input, you can email DHS at waiver.reimagine@state.mn.us. And you can also subscribe to receive DSD e-list announcements on the DSD e-list page, which would get you on the listserv to be notified of information related to Waiver Reimagine. Next slide, please. So on behalf of the Improve Group and the DHS Disability Services Division, we thank you for joining us today and for sharing your input. We value your input and appreciate your time. I want to notify you that we will be keeping this Zoom room open for about probably 5 or so more minutes for any final questions. And you can continue to chat those in and we'll make sure that those are recorded. If you do not have any other questions, you are free to leave, but we'll keep the space open to gather any last questions or input. So again, thank you very much, and we hope to engage with you in the future. Thanks, everyone.